Good morning, it's November 3rd, and this is To My Liberal Friends. Here we are 5 weeks into the government shutdown, and both sides continue to try to blame the other. Democrats say all Republicans have to do is give them what they want, and they'll vote to open the government. Republicans say just vote to open the government, and we'll negotiate with you. Democrats have hung their hat on the health care argument. They're demanding that the extended subsidies, something they inserted in the law during the pandemic and placed a termination date on them for the end of this year, be made permanent. They have an additional list of demands, but they're not as politically palatable to the public, so you don't hear them mention any of those. Now here's one fact they seem to ignore. It appears that there are sufficient votes within the Republican caucus to give the Democrats what they want. Democrats, using the anti-Trump reasoning, say they don't trust the Republicans. But if you take any kind of poll of the two caucuses, you'll find the votes are there to extend these health care subsidies. Then you have the spacious argument by some Democrats, especially those that have no real understanding of how the Senate operates, that Republicans have the majority, so they can simply pass the CR and be done with it. They ignored that Rule 22 of the Senate, the filibuster rule, requires 60 votes to move the CR forward. If we're being technical, they're voting on a motion to proceed to the CR, and that keeps coming up short with only 55 votes. 3 Democrats have voted to open the government: Senators John Fetterman from Pennsylvania, Catherine Cortez Masto from Nevada, and Angus King of Maine. And 1 Republicans voted no. That's Rand Paul from Kentucky, and he votes against all CRs, urging the Congress to return to regular order. Well, former President Barack Obama has jumped into the fray, and he's been very public in this dispute, telling Republicans they should negotiate with Democrats and extend the enhanced subsidies. Well, that's a big stretch from what he said about shutdowns when Republicans were demanding negotiation. I was working in Washington during that shutdown. It was 2013, and the issue was once again health care, with Republicans objecting to Obamacare. It was Republicans that were filibustering, and Democrats were outraged. President Obama had a lot to say about that shutdown. Here's what he had to say then. Quote, "Think about this, shutting down the government just because you don't like a law that was passed and found constitutional." End quote. That's what he said in September of 2013. He went further, quote, "No Congress before this one has ever in history been irresponsible enough to threaten default, to threaten an economic shutdown, to suggest America not pay its bills just to try to blackmail a president into giving them some concessions." End quote. Well, Congress needs to pay our bill on time. Congress needs to pass the budget on time. Congress needs to put an end to governing from crisis to crisis. That was Obama as well. Furthermore, in 2013, he said, quote, "If Republicans don't like the law, they can go through regular channels and processes to try and change it. That's why we have elections." Those statements are a far cry from what both Obama and Democrats are saying today. I guess it depends on who's voting no on keeping the government open. But Obama was correct then, and he still is correct today. Let's go back to regular order. Let's get this done the way Congress is supposed to operate. Now, before we go any further, we should also address the changes made in the American Rescue Plan and the Inflation Reduction Act to be eligible to get a subsidy. The American Rescue Plan and Inflation Reduction Act temporarily eliminated the traditional 400% of federal poverty level income cap through the end of 2025. The Democrats lifted the income limit and replaced it with an 8.5% cap on premiums to modified adjusted gross income. That means families with 6-figure incomes, some of them over $200,000, are getting subsidies, something that the original act of ACA did not expect to occur. But that's what they're doing now. And I mentioned the other day about a couple that Senator Amy Klobuchar used as her example. It was almost as bad as using Abrego Garcia as the poster child for illegal immigration. This couple lives in Idaho, and they were getting the enhanced subsidy. They're 61 and 60 years old. So they made a decision that they would retire early, a decision they made on their own. Nobody told them to. They left their employer health care programs. With the subsidy, they felt they were okay. And here's the kicker. Their annual income in retirement is north of $130,000. Well, the median family income in the U.S. is $83,000, and that's for a family of 4. The average income for a couple in retirement is just below $90,000. This couple has more than that amount, and they made a conscious decision to retire, and somehow they and the Democrats believe the taxpayer should subsidize their selfish decisions. They're waiting to get on Medicare, and they want you, the taxpayer, to pay for their decision. The bottom line is that Obamacare was designed to help out the needy in this country to get health care. It was not meant for high-earning couples to take advantage of a loophole in the system, but that's exactly what a lot of people are doing. So when you listen to Democrats talk about why they're willing to hold the nation hostage for their health care demands, Ask them why they keep allowing people with substantial incomes to be included in a government program that was intended for those who really need help, not the rich people out there wanting to retire early. This has been To My Liberal Friends. Thanks for listening.